Now to the latest on the coronavirus pandemic. Health officials are closely monitoring the rate of infections after the Thanksgiving holiday. In spite of the CDC advising people to stay home with smaller groups, airports saw their highest travel numbers since March when the pandemic began. Now, the nationwide death toll from COVID-19 reached more than 263,000 yesterday. And U.S. hospitalizations are at an all-time high, skyrocketing to over 90,000 patients across the nation. Adriana Diaz is in Chicago, where overwhelmed hospitals are preparing to get even busier.
Well, here at Northwestern Memorial Hospital, they've actually reduced the number of elective surgeries just to make sure there's enough room for the increased COVID patients they're seeing. And listen to this, local health officials say 1 in every 17 Chicagoans has the virus. That's why doctors across the city and the nation are trying to curb the spread to avoid what could be a devastating holiday season.
I was worried after Halloween. I'm far more worried after Thanksgiving.
Hospitals are bracing for a post-holiday influx of COVID patients. Dr. Meeta Shah works in the ER at Chicago's Rush University Medical Center.
We will not get a reprieve because then Christmas comes and then New Year comes. So if we're just stacking surge upon surge upon surge, I am significantly worried about that.
The lobby at Rush has been transformed into a COVID triage area to make room in case there's a surge of patients in the coming days. And though a projected 50 million Americans still traveled for the holiday this weekend, outside Los Angeles, this bumper-to-bumper traffic wasn't for holiday travel. It was to pick up a Thanksgiving meal from a food bank.
So many people just appreciate being here, being able to get out.
In Northwest Indiana, volunteers rallied to keep a local tradition alive, turning a massive Thanksgiving feast for 1,500 into a drive-through celebration.
God, we lift up these families who are mourning the loss of their loved ones because of COVID.
For others, the holiday was a time to reflect on a difficult year. Members of a church in hard-hit South Dakota set up hundreds of empty chairs outside the state capitol, one for every South Dakotan who succumbed to the virus. And for the Spano family in Connecticut, dinner was tough without their brother and son, Daniel Spano, who's in the picture frame. He died from COVID earlier this year. Thanksgiving was his favorite holiday.
We're gonna video chat and, try to have some sense of normalcy, but no matter what we do, it's not gonna be the same.
Back in Chicago, like so many frontline workers, Dr. Shaw spent her Thanksgiving in the ER.
You step out of your front door and you're sad that you're leaving your family on a holiday. But when you walk into these doors, this is your work family. And right now, my work family is hurting.
And here's why Dr. Shah and so many others are concerned. According to the city's public health commissioner, 1 Chicagoan is diagnosed with the virus every minute. Paula?
Adriana, thank you. For more on this, let's bring in Dr. Bob Lahita. He's a professor of medicine at the New York Medical College and chairman of the medicine at St. Joseph University Hospital. Doctor, thank you so much for being with us. All right, pandemic aside, what are the normal trends of illness that we usually see, like cold and flu, coming out of Thanksgiving weekend? And how do you think that the coronavirus is going to factor in?
Well, we usually see, Paula, we see the colds and the flus after these large gatherings of family members. Hopefully this year, everyone will have already received their flu shot. If not, go out and get it within the week. And this could be a problem. We see surges, and one of the problems we do have is differentiating the flu from COVID in the emergency room, making sure that the patient either does or does not have coronavirus infection, because that's a whole different ball game, Paula.
Now, a lot of talk about this new coronavirus model from the CDC. What is different about this, and what can we learn from this new model?
The new model you're referring to, I presume, is the numbers that have been tested versus not tested. Is that correct?
Yes.
So there really, our belief now, since there are so many patients, 100,000 per day now being infected, we presume that there are far more people infected than the numbers will tell us. We suspect that there are 8 times the number of cases in America, based on the fact that we are only looking at numbers based on testing. And a lot of people are not tested. So it's possible that by the end of this holiday period, there will be 100 million people affected by coronavirus. At the end of September, the prediction was that this was 53 million people. But now with the numbers going up because of the holiday gatherings, because of people on airplanes, because of people traveling from state to state, we may see upwards of 100 million people. And that's almost a third of the United States. And that's really incredible. But what we do know is that 71% of people are not yet infected based on those numbers. And if that is the case, then we really have to be very, very careful going forward into the Christmas holidays.
Now, a new study published in the Journal of American Medical Association suggests that most Americans are still susceptible to COVID-19. So what do you make of this, and how would you counsel people to go about their lives over the next few months between now and when that vaccine is hopefully widely available?
Well, you heard from the doctor in Chicago. We just see mounting numbers. We see surge upon surge. Our hospitals are filling up. We have emergency rooms now that have their own ICUs built into the emergency room, such as ours. We are trying to control things, but it's very, very difficult. Again, across the country, you've got a prevalence of COVID-19 antibodies that are rising and rising, but that's just the tip of the iceberg because most people don't get tested. And so what we're looking at with the Christmas holidays coming is a tremendous increase. We implore that everybody please wear a mask, keep social distancing, and most importantly, perhaps other than wearing a mask, is wash your hands or use that hand sanitizer, which is so commonly present in almost all stores, Starbucks, everywhere you go. Just use the hand sanitizer because you don't know what you've touched, and you don't know inadvertently that you may have been exposed to the virus left by somebody else. Paula?
Yeah, hand sanitizer, it really is everywhere now. You saw it a few places before, but now it's literally everywhere you look. Now, according to a new study released by the COVID Collaborative, Black and Latino communities, they're showing a higher degree of distrust when it comes to COVID and the vaccine. Fewer than half of Black people and 66% of Latinos said they would definitely or probably take the vaccine, even if it was offered free of charge. So how do you combat this kind of distrust, and what do you do to communicate and to convince people in these communities that the vaccine is safe?
Well, Paula, we have to educate people, and I spend a lot of my time telling people how safe the vaccines are, particularly since we have several different kinds of vaccines. The most likely one to be ready for us in mid-December is the messenger RNA vaccine, which is from Pfizer and Moderna. Now, the Black and Hispanic population have been disproportionately affected. We see huge numbers of African American and Latino people succumbing to this virus. And no one knows why. It could be related to the socioeconomic status, where they don't take Ubers, they ride the subway, they ride the buses. They're in close contact to members of their family as well. We don't simply know why they are disproportionately affected. But what is clear is they do not want to receive the vaccine, especially the Black people. And that has a lot to do with the unsavory history in our country of things like the Tuskegee experiments, which occurred in the earlier part of the last century. Those were terrible things to inflict upon a segment of the population, creating hundreds of years of mistrust. And we're seeing it now. We're seeing that mistrust going forward. So I just really want to educate everybody and tell them there is no specific selectivity of the vaccine and as regards adverse events or adverse effects in a particular race, Asian, Black, Latino. There is no difference between those people and the white people as far as effects of the vaccine. It's going to be just as effective in them. And most importantly, they should probably get the vaccine before anybody else. That's just my idea. Paula?
So the Supreme Court blocked New York's push for continuing restrictions in houses of worship in Brooklyn. The state's governor, Andrew Cuomo, said the decision, quote, doesn't have any practical effect because the restrictions they had in place, they've already been eased. But less stringent capacity restrictions, which were also rejected by the Supreme Court's decision, are still in place in 6 other counties, including Staten Island. So do these rulings concern you as a health official, as a health expert?
These rulings do not concern me because I think that the churches that I've gone to, the temples that I have seen, they are socially distancing people. Now, I should say there are exceptions, such as in the Orthodox Jewish community here in New York State, where people do not pay attention to mitigation processes such as wearing a mask or having social distancing. But that is being corrected by the authorities right now. However, it is important to understand that Governor Cuomo was upbraided by Amy Coney Barrett, who was the last and deciding vote, 5-4 decision to allow 50% capacity in the churches. And I think if people are careful, they will not crowd into the churches and they will keep their social distancing, as I have seen them do. I think within the Catholic churches, a lot of the Protestant churches, and certainly in the synagogues, we see that the rabbis and the priests and ministers have been very, very mindful of the social distancing, keeping people apart and mandating masks. And also, like the stores and Starbucks, as you go into the church or the temple, there are disinfections, there are the hand sanitizers. So everybody's getting the message. And I think that I understand where the governor's coming from, but I also understand, more importantly, where the Supreme Court is coming from. Paula?
Dr. Bob Lahita, thank you so much for joining us. We appreciate it.
Thank you.